Sgheri, a glaucoma specialist in Santo Stefano Hospital located in Prato in Tuscany. Santo Stefano is a second-level hospital. In our glaucoma center, every year we take care about 450 patients. Usually I see about 10-12 patients each week who are referred me by general ophthalmologist as glaucoma suspect or glaucoma diagnosis. In most of these cases, glaucoma is confirmed and it requires a follow-up. At their first visit in our clinic, patients seldom came with a complete set of CT and visual field tests done. This happens because of two things. First, not all of general ophthalmologists require a CT and visual field tests for glaucoma evaluation. Second, because of the long waiting time to get these tests done, that it can be up to several months. When they come here in our glaucoma center, we make sure that all the necessary tests are completed here. So we take care of them, making sure that they complete serous OCT evaluation and HFA visual field evaluation. When their glaucoma is under control, patients return to their general ophthalmologist for routine care. We share all the tests that were done here, and we advise general ophthalmologists to follow up with the same serous OCT and HFA visual field test. Having the same diagnostic platform helps me to communicate with the referring doctor and with the patients, especially when they have to come back to me in the next future time. OCT is really important for me, especially in the patients who have challenges in taking visual field tests, like high myopia, dry eye, excessive blinking, elderly, and frail patients with slow reflexes. OCT is also really helpful in patients with early stage of glaucoma when visual field test is still normal. For example, in a young patient with borderline IOP and a family history for glaucoma, I would start with an OCT and I would suggest frequent follow-up. Using ZEISS and Glaucoma Workplace, we can establish a baseline for recognizing a progression. I would monitor for any slight but developing defect. I'm tracking with GPA to know when it's time to start a treatment. When glaucoma is not confirmed, or if a treatment is not justifiable or premature, I prefer to avoid unnecessary medication and their side effects. I like using ZEISS data on Forum Glaucoma Workplace for visualizing on a single display the ONH area RNFL analysis together with the macular area and the GCL thickness analysis. I want to make sure that in every clinical case I fill out the IOP value for each visit and if any kind of medication or if a treatment were done. Forums allows me to keep all the information together and to give it to me at a glance when I need it. This software helps me to use less time to manage and analyze results, so I can dedicate more personal attention to the patient without extending the exam time. It keeps all the data well organized, which is helpful for a more efficient care. Patients do notice that and become more confident, more relaxed, and easier to talk to. Typically, I show HFA and ZEISS tests to the patients. It is very important. I want to achieve better patient confidence and to reduce their anxiety about going through a treatment. When I reveal the GPA reports on a single graph, they immediately understand what's going on with their glaucoma. It is very helpful for convincing them that regular exams are important for keeping glaucoma under control, especially in these cases where I will be referring them out, like in the one that we are presenting today with Dr. Sacchi. The Glaucoma Center at San Giuseppe and Santo Stefano are using the same diagnostic platform, HFA, ZEISS and Glaucoma Workplace. We seamlessly correlate our diagnosis and treatment decision. This gives an important advantage of an expedient consultation with Dr. Sacchi and gives to my patients the best possible and timely care. Normally, I will discuss each referral remotely with Dr. Sacchi, but today we decided to meet with him in Milan so we can present together this challenging clinical case.
Welcome in Milan. I'm Matteo Sacchi, glaucoma specialist, and we are in San Giuseppe Hospital, a third-level university hospital in the center of the city. The patient is the center and the focus of our glaucoma service. We perform all the examination during the same day, including OCT, visual field, and intraocular pressure measurement, so we can have all the relevant data for the patient consultation. We have facilities to perform extra exam, as supine intraocular pressure measurement, diurnal curve, or ocular surface assessment in our anterior segment and ocular surface lab. Education and research are a key part of our activity, and we are involved in the medicine degree student training and ophthalmology resident program. We offer to the patient all the treatment, starting from laser trabeculoplasty and including mini-invasive glaucoma surgery and standard surgery as trabeculectomy and tube implant. A special expertise I'm particularly proud of is the care of children with pediatric glaucoma. Patient referral is common, and we take care of many patients across the country. When managing a patient who is referred, having the whole history is essential, and it's easier to me to catch the key feature of the case if the previous examinations are available. For the management of patients with glaucoma, we use both structural and functional examination. The recommendation is that patients undergo an exam always in the same center and with the same machine, so we can easily compare the examination during the follow-up. The Glaucoma Forum Workplace is a new technology for the collection and the analysis of data coming from OCT and visual field. With this technology, the decision-making process is easier, time-saving, and more accurate, and is really help the clinician in improving the quality of care of our glaucoma patient. I'm very happy to welcome you. We are going to start our surgical session today with glaucoma cases and cataract surgery. Let's go start.
La dottoressa Sgheri e il dottor Sacchi hanno impedito al glaucoma di rubarmi la vista, hanno conquistato la mia fiducia. Quando la dottoressa Sgheri mi ha consigliato l'ospedale San Giuseppe di Milano per un altro intervento, ero un po' preoccupata, ma poi, quando sono stata ricevuta dal dottor Sacchi, lui era già a conoscenza della mia storia. Ho capito subito di essere in buone mani. Mi fido dei miei dottori, stanno insieme curando il mio glaucoma, condividono con me i risultati degli esami e mi spiegano tutti i passi che fanno per impedire alla mia malattia di andare avanti. Mi hanno spiegato quale parte dei miei occhi sta colpendo il mio glaucoma e mi hanno aiutato a capire. Anche se non me ne accorgevo, la malattia sta gradualmente portando via la mia vista. È solo grazie a loro che adesso capisco quanto sia importante fare i controlli regolari e seguire le terapie. Guardare gli esami insieme ai miei medici mi ha reso più fiduciosa di essere sulla strada giusta per prendermi cura dei miei occhi. È importante sentirsi sicuri quando si vive con il glaucoma e si devono affrontare gli interventi. I miei dottori hanno salvato la mia vista ed il nostro obiettivo adesso è quello di continuare a preservarla. Insieme ce la faremo.
Today, I'm happy to share with you a challenging case of glaucoma. Dr. Sgheri, a colleague from Italy, and me were able to take care of using the Glaucoma Forum Workplace, a new tool for the collection and the analysis of glaucoma data. This is a good example of how the new technology can really help the clinicians to make the decision-making process easier, time-saving and more accurate.
Patient was referred to Santo Stefano Hospital due to high IOP in myopic eyes. She was treated for 3 years with topical therapy. When she came to us, her target pressure was any more reachable only with topical therapy, so we decided to perform a mixed surgery in both eyes. Unfortunately, the left one started to get worse due to a fibrotic reaction of her blebs. We decided to perform a trabeculectomy far from the previous surgery site, but some months later, this underwent to a fibrosis reaction as well, so I required an advice from Dr. Sacchi.
Unfortunately, trabeculectomy failed, probably because of the intense fibrotic reaction due to the previous surgical treatment. Glaucoma Forum Workplace really help us in collecting longitudinal data coming from visual field and OCT. Visual field starting to progress after the trabeculectomy, but data coming from OCT were even more relevant because the thinning in retinal nerve fiber layer was faster compared to visual field progression, clearly indicating a structural damage and progression. At that time, we scheduled a long tube implant. The surgery was uneventful, and it's been 2 years from the surgery now. The patient is still stable and the pressure is still under control. Thanks to the data Dr. Sgheri collected using this platform, I was able to have all the history of the patient, and I could catch the key feature of the case and to schedule the proper treatment in the right time.
After the referral and a successful surgery, patient was able to come back to Prato only 1 week later. Me and Dr. Sacchi were monitoring together all the data and all the therapy for the post-operatory visit. Another visit was planned 1 month later. We can say that in the last checkup, no kind of progression were detected and her glaucoma is still stable. Patient was really happy to know that Dr. Sacchi and I were managing her case together, and it was really more easy for her to get to San Giuseppe Hospital, already new in this, and going through the surgery.
During the follow-up, the patient was aware that Dr. Sgheri and me were taking care of her remotely and together, as she was a complex case of uncontrolled glaucoma. She appreciated that we could use any clinical data without missing any relevant information. This is a good example of how we can use this new modern platform to make the decision-making process easier, time-saving and more appropriate. This really helps clinicians to improve communication between doctors, communication between doctors and patients, and finally to improve the quality of care of our patient with glaucoma.